Hello, and welcome to Pull Up with Limbs and Things. This is our last Pull Up with Limbs and Things of the year. And tonight we are talking about Can You Hear Me Now? We have Dr. Terrence Pleasant Jr. with us tonight. He is a physician in Michigan and he knows all about hearing and aging. And so tonight we've invited him to talk to us a little bit about some of the things we experience as we get older. I often find a lot of people when I come up to your house, your TV is so loud you can't hear the doorbell ring. Or you may be having me come in, and because my voice is softer, you might not hear everything I'm saying. And especially behind the mask, it's been difficult for us to communicate. So tonight we're talking about hearing. All right, Dr. Pleasant, welcome. Tell us a little bit about yourself and about hearing and aging.
Awesome. Thanks, Dr. James, for having me again on this wonderful event. I'm Terrence Pleasant. I'm one of the otolaryngologists or ear, nose, and throat surgeons at the University of Michigan. I am originally from DC and did my training at Georgetown for medical school and then the University of Michigan for residency in my subspecialty training and then stayed on as a faculty member. It's an honor to be here with you guys tonight to talk about something that's actually very near and dear to me, which is age-related hearing loss. It's a condition that commonly affects people as they get older. I would say about a third of patients who are 60 years or older have some form of hearing loss, and that number increases dramatically to about 50% of patients who are above the age of 80. Oftentimes, it's identified either by family members or physicians who are communicating with you and realize that oftentimes, you're struggling to hear in loud environments. You have difficulty just listening with your TV or your TV volume is up. You're constantly asking people to repeat themselves. It's a condition that, makes it much more challenging for you to hear people with like children or women, because they tend to have higher frequency voices. Again, you really struggle in loud environments, and it can really have a negative impact on your quality of life because you tend to isolate because people really have a hard time hearing you. Not only does it impact your quality of life negatively, it can also impact your cognitive abilities, because in the way I think about this, people say, well, how does my hearing loss impact my ability to sort of think and learn things? It is because oftentimes you're using so much of your brain power to try to hear in loud environments. You're taking away from your ability to sort of store and learn new things. So I really think it's important for you as someone who's getting older to have an opportunity to at least get a hearing test, particularly if you have concerns or your family members have concerns or one of your physicians have concerns.
Absolutely. But then there are some people that possibly live alone and they can't tell that they're having a hearing loss situation until someone comes to their home. What should they do? How can you know that you are losing your hearing when you don't live with someone who's able to tell you?
Yes, that's a great question. It can be really difficult for you as a person to realize that you have hearing loss, particularly if you're living alone and you're not interacting with family members or friends.
Mm-hmm.
Commonly, it's difficult though for those people that have certain degrees of hearing loss to actually communicate on the phone. So they may have a harder time having phone conversations. And if you are, then I would say I would begin to think about talking with your physicians about having a hearing test done, just to get a baseline to determine if you have a degree of hearing loss.
That's a good point, because I think, excuse me, so many people, we hear on the phone and then we switch ears if we can't hear that well. And then we try to say that the other person on the phone, and you just can't hear. And so we go back and forth with those types of things. If you are watching us live, hashtag live. If you are catching this on the replay, please hashtag replay. Thank you so much for watching. If you do have a question about hearing or aging, please put that in the chat and we'll answer it. Okay, so what's considered normal hearing loss as we get older?
So hearing loss is not normal, period. You should be able to hear.
At the same level as you get older?
As you get older, there's a condition called presbycusis, is age-related hearing loss.
Right.
But again, as I said earlier, even 50% of people that are 80 years or older have normal hearing. So it's not a guaranteed thing that as you get older that you will have hearing loss. But again, 50% of people do have hearing loss at the age of 80. And so it's a condition that is not preventable, it's not reversible, it's usually permanent. There's some things that you can do to try to sort of lessen the degree to which your hearing loss, the degree of hearing loss. So, for
Okay.
example, limiting loud noise exposure. So, if you're a type of person that attend concerts, wearing, earplugs
Yeah.
will certainly sort of lower your chances of having hearing loss. But hearing loss as you age, yes, it is one of the things that's a part of aging, but it's not necessarily a guarantee that you will or will not have hearing loss as you get older.
Okay. And then a lot of us, when we are noticing that we're having a hearing loss, we go to Costco's or we go to Sam's and we see an audiologist. Now, is that the person we should see, or should we see someone else?
That's a great question as well. So, an audiologist is the person that you want to see. They are specifically specialized in testing and examining one's hearing. And so they have the skill set, the training, and the capability and the equipment to actually determine whether or not you have hearing loss. And not only can they do that, they can tell what type of hearing loss you have. So, age-related hearing loss is a nerve type hearing loss. There are other forms of hearing loss, such as what we call a conductive hearing loss. So that's a different type of hearing loss. So if your ears are plugged with wax, commonly you hear kids who have a lot of ear infections. That's a different type of hearing loss, which, audiologists can help to sort of differentiate. Now, you can have a mixed form of hearing loss. So you can have what we call a conductive hearing loss, where sound has to travel through your ear and somehow the sound is not getting to the brain. And that can be from a hole in the eardrum or fluid behind the ear. And then when you're talking about the nerve type hearing loss, again, that's the one that you see commonly in elderly patients. And so the audiologist is really important in helping you identify the type of hearing loss, but they can also help fit you with hearing aids if you're a candidate for hearing aids or other amplification devices. And so it's a good starting place. Sometimes you may need to see someone like myself for further testing and or imaging or different devices to help you sort of address the hearing loss.
Okay, so you're an ENT specialist. So when does a person need to see you? And is it their primary physician that has to make the referral, or the audiologist?
Yes. So typically, an ear, nose, and throat specialist does require a referral, usually from your primary care doctor.
Okay.
Um, you know, in younger patients, you actually do need a referral, meaning kids, I should say, you need a referral before you can even get hearing aids. The nice thing about adults, you can actually get hearing aids through your audiologist. So you don't necessarily need to see an ENT specialist. However, if your hearing loss is so bad such that you're not getting benefit from your hearing aids, then you should see an ENT specialist because there are other options for you that are available to kind of help you hear better. The other reasons to see an ENT specialist if you're having hearing issues, if it's unilateral, meaning one side, if you have ringing in your ears, that's a common condition that goes with age-related hearing loss. If it's one side, again, you would want to see an ENT specialist for that. If it's a ringing in your ears that sort of goes with your heartbeat, that's another reason to kind of see an ENT specialist because that could be a totally different thing. And so age-related hearing loss typically affects both ears. It's not something that's unilateral. And so if you develop a unilateral hearing loss, that's something that would require a more specialized care beyond just an audiologist.
That's a good point, because I hear a lot of people often say, I'm getting older, I'm losing my hearing, but it's only over here, or it's only on one side. But that's good to know that it's not age related if it's not in both sides. Is that true?
Typically, correct. So age-related hearing, as you age, it's, just kind of make light of things, right? You don't age on one side of your body typically. So,
Mm,
you would expect if it's age-related hearing loss, it should impact both ears.
gotcha. Okay, we have a quick question. My wife says I can't hear, but I'm only 38. Could I really be experiencing hearing loss?
That sounds like selective hearing to me. No, just kidding. No, you can certainly. I mean, it's interesting because as younger patients are now presenting with nerve type hearing loss, and particularly patients who use earbuds, and I'm not at all saying that that is a reason that their
Mm-hmm.
hearing loss is there, but especially if you have your music louder and you're wearing earbuds, we are seeing more patients who that are younger that have some form of hearing loss, and we attribute that to a lot of earbud and AirPod usage. So I would say if your wife is concerned, then you probably should at least let your primary care doctor know and get a hearing test at baseline.
Absolutely. Okay. Let's see. What are the other solutions to hearing loss other than a hearing aid? Or is that it?
There, it depends. So, hearing aids, I would certainly say if you have milder forms of hearing loss, is probably the most appropriate and least invasive thing. There are other devices, for example, particularly this is again with the nerve type hearing loss. You can get cochlear implants, which is a surgical procedure uh,
Right.
that is offered to patients who do not get benefit from hearing aids that have a severe degree of hearing loss. So that is a surgical operation, and it is sort of one of the last resorts to try to preserve or at least maintain some of the hearing, or restore, I should say, is a better word, hearing.
Okay. And then I know you talked about an audiologist prescribing the hearing aids, but then there's some of us who I don't know if it's vanity or if it's just they don't want to look that old and they don't want to use the hearing aid at all. Are there any things that could possibly happen to you? You don't wear the hearing aid, you continue to have significant hearing loss. How can that affect you as you continue to age?
Yes. Um, so I briefly talked about this earlier in terms of, hearing loss is really serious in terms of its impact, not only on your quality of life, right? There's been multiple studies have shown, particularly even out of Johns Hopkins, they do a lot of this research that, depression, so hearing loss is closely associated with depression.
Mm-hmm.
It's closely associated with social isolation.
Mm-hmm.
Numerous of studies have demonstrated, again, cognitive decline. So your cognition, your learning, and memory can be greatly impacted. Even something safety is a big thing, right? So crossing the street and not realizing that you don't hear the car to your left or hear to your right. I mean, there are a number of sort of repercussions for not addressing your hearing loss, or
Mm-hmm.
possible repercussions. Those are just a few things, and so I think it's really important to get them checked out. And now things are a lot better in terms of the devices that we have available, and being able to sort of hide them, and people not really noticing that you are wearing hearing aids.
Right, right.
And so talking to the audiologist about that is definitely important.
Gotcha. Okay, safety is highly important. I think we see that a lot in physical therapy when people are doing an activity with us or doing exercise with us, but they didn't hear me say stop, or they didn't hear me say, maybe you shouldn't do it like that, do it this other way. The safety aspect of going too far or too much can really hinder them from making more progress. But that is very true. And even especially in the community, because a lot of times, even in your home, though, if we are really telling the truth about it, um, there are some people who've had damage to their home because they did not hear that a smoke detector was going off. They didn't hear that they had left something on their stove. there's so many ways, or that water was running. And so water does not sound as loud, of course, as something on your stove, but it's really important that you are hearing these things, not just for those safety aspects, but for the environmental benefits of it.
Correct.
Yeah. Okay. So let's talk about some of the things I see in the younger, older adult population where they're like, okay, I'm starting not to hear, but I know that I've seen something that talks about candling. There's something that talks about earwax removal. And I'm going to do my part right now before I get older and find out that I can't hear as well. And I'm going to get this earwax out and I'm going to see if I can hear better. Is that a good thing for you to do?
You know, so I've been an ear, nose, and throat surgeon now for 7 years and counting, and actually just came across the term the candling term recently. I had no idea what
Really?
that was.
Okay.
And so, for those of you who don't know and was naive to the term like myself until recently, it's a process in which you essentially buy a candle. And the thought is you light it, and then it's supposed to dissolve or help get rid of the wax in your ear. It
Mm-hmm.
is not something that I endorse. It's not something that I think is safe,
Mm-hmm.
and I would not do it. There are a lot safer ways to do, to address wax. So wax, as I mentioned earlier, could be a part of hearing problems. And so the question is, how do you get rid of wax? There are some people that just make a lot of wax. Technically, our ears are self-cleaning, so wax actually just falls out and you don't realize it's falling out either on your pillow or elsewhere. Um, but one of the things that you can do to help facilitate wax removal is to get a mix, particularly if you have intact eardrums. So if you don't have ear tubes, if you've never had a hole in your eardrum, 50% water, 50% peroxide, get a little syringe and just flush your ear. The important thing with that is it needs to be, at least, it needs to be body temperature because otherwise it can make you dizzy. You can do that once a week. That would be fine. Getting a little
Hold on. Say
dropper.
that again. Say that again.
Yeah.
Do what now?
So you can mix water,
Mm-hmm.
50% water and 50% peroxide in a little syringe and just flush your ear once a
You got
week.
to
And
turn your
that
head
can,
to the side.
you can just put it in and then and turn your head down to help get the wax out and do the same on the other side once a week. That'll help sort of mobilize, particularly for patients who suffer from wax impactions. You can do that to help get the wax out. After you do that, though, you can then drop once a week, get a little dropper and drop a little bit of baby oil or mineral oil in your
Mm-hmm.
ear. And that'll help sort of loosen the wax up and get wax out. I do this all the time for my patients. Now, it's neither of those methods are perfect, and some patients have chronic wax impactions, and they actually should see an ENT specialist for that reason. And I have patients that I follow just every 6 months to come in for an ear cleaning. And that's
Uh-huh.
okay because that can really, again, it impacts your hearing. What I don't want you doing though is sticking candles in your ears or, Barbie pins or Q-tips, especially. No, no. The only thing that goes in your ear is your elbow. And if you can get your elbow in your ear, you're good to go. But you should not be putting anything in your ear outside of the couple things that I just mentioned in terms of the irrigations and a little drop of baby oil or mineral oil. You should see an ear, nose, and throat specialist otherwise.
Now, that's interesting because last time when you were here, you talked about not using Q-tips in your ear. I'm a fan of Q-tips in my ear. And that bothered me. But okay, so after you put the mineral oil and all that stuff in your ear, don't you need something to help it get out?
Nope.
It's
It'll
just
just
gonna
come
slide
out.
out.
Yeah, it'll come out and it'll pull the wax out. So the mineral oil and baby oil you can do, like I said, like once a week. Just particularly, I recommend this for patients who are really struggling with wax impactions. And it really does loosen up the wax and can really help it sort of, again, your ears are self-cleaning and eventually the wax just falls out. But if it's not helping, yeah, at some point you should see an ear, nose, and throat specialist. I know, Dr. James, you love your Q-tips, but I can't endorse Q-tip use in any of
I've
people.
tried. I even
I
got a
know.
different device, the little circular one that is like a cone shape that'll go inside your ear to pull out the wax. I was like, maybe he'll think this is better.
I don't. Nope. I don't
I
think so.
know. I know. So, what about getting like swimmer's ear when you're putting liquid or anything in your ear? Wouldn't that cause that?
Yeah, so swimmer's ear usually happens because you've had some trauma to your ear, or and patients who chronically pick their ears, if you use Q-tips, that's the reason why I tell patients don't put anything in their ears, because if you make a little cut in the canal, you cause trauma. Then that can allow bacteria that sort of just hangs out on your skin. Your ear canal is full of skin. Um, to sneak in, and then it causes an inflammatory and a reaction, and then your ear canal swells up. It becomes more painful. It's an infection, and you have to treat it. And so that's why, all jokes aside, I really discourage people from using um, instruments or anything in their ear canals, because it can certainly traumatize it, and cause a swimmer's ear. Now, swimmer's ear can happen just as a result of you swimming in lakes and dirty waters, and cause it certainly can happen. It's rare to happen. It's usually oftentimes a result of some trauma, and then bacteria kind of seeping in and causing an inflammatory response.
Gotcha. You have a few comments. Hi, Dr. White. I have heard that about the baby oil. I thought it was a myth.
Sorry, heard about a what?
The baby oil and thought it was a myth.
Oh, no, that's not a myth. That is something that many of us as ENT specialists recommend that can certainly help.
Gotcha. Hi, Tara. What about using a washcloth just to remove the wax around your outer perimeter? Is that okay?
That's fine as long as you're not going into the ear canal. I mean, using a washcloth to clean your ear. I don't want you walking around with dirty ears on the outside, but no one really cares about the wax on the inside. But yes, it's totally fine to use a washcloth or something just on the outside of your ear.
Gotcha. Okay, and hi, LaPetra. If your ears make a lot of wax to the point that you feel the need to use a Q-tip every morning, plenty of wax comes out on the Q-tip. Should you see an ENT?
I would see an ENT for that. Yeah, because he or she can definitely clean your ears out and get you started on the right path, and then you can do some of the things like the baby oil and or the rinses once they've removed all the wax to help prevent them from building up.
Okay. Dr. White, taking my mom to an ENT specialist for ringing in her ears, and there's a 3-month wait until her appointment. Can her primary care help her in the meantime?
Yeah, that's a great question. 3 months is is actually pretty good in terms of getting in. Yeah, I know it's crazy. But in terms of, so that's called tinnitus, and that's a ringing in the ear.
Yep.
One of the things you can do, if again, hearing loss and ringing in the ears go together. They're not always together. They can be mutually exclusive. But in patients that are older that have ringing in their ears, that usually is not with their heartbeat. A lot of times that's associated with hearing loss. So you can try to get a referral or see an audiologist, whether it's at Costco or someone, just to see if hearing loss is contributing. We don't really have an understanding as to why tinnitus happens or ringing in the ears. It's thought to be like a phantom limb. So you think of patients who have, or people who have had amputations of their limbs, and they still get the sensation that they still have the limb.
Mm-hmm.
In patients who have hearing loss, your brain sends out a signal. The thought is your brain sends out a signal, so it's kind of like a phantom sound. So your brain is trying to capture those sounds. As a result, the patient experiences ringing in the ears. And so that can be really problematic. Unfortunately, we don't have a cure or treatment for it. However, we do know that patients that have ringing in their ears and an associated hearing loss, hearing aids actually help that ringing. And so it is important for your mom to at least get a baseline hearing exam. Sometimes there's not associated hearing loss, and we just have unexplained tinnitus or ringing in the ears.
Gotcha. Let's talk hearing and balance. So, for a physical therapist perspective, your balance is all goes together with your inner ear balance. All of those things have a connection. And so, when we are working with someone and we find that they cannot hear as well, then there is a propensity that their balance is not going to be great, right? So, when you have people come to your office and you're doing an assessment on them, do you ever look at their balance?
Yes. So, as an ear, nose, and throat specialist, we do worry, I mean, about your ear imbalance. Your balance organs and your inner ear organs are essentially connected. And so it's not that every person who has a hearing loss has balance issues, but they do sometimes go hand in hand because of various things. So trauma, one, head trauma, which can result in a hearing loss and or damage to the balance organs. Two, it could be an infection of both the inner ear organs and the balance organs that can cause issues. But again, they're connected. So as you age, sometimes, again, there's an age related hearing loss or a decrement in your hearing because of the impact on the nerves and other inner ear structures. You can also have that same sort of age related impact on your balance organs. And so if you're having hearing loss, imbalance issues, it's really important actually to get, again, a hearing test. But they're vestibular therapists, people that are essentially physical therapists, but they are, they can test balance and they have all these special um, tests that they can do to see if your balance is off based on your vestibular organs or your balance organs that are near your inner ear.
Mm-hmm. Absolutely. Thank you. Okay. Hi, Dr. Mars. When and at what age is best to get a baseline hearing exam? And does one have to have an existing condition for a baseline exam?
Yes. So there's no consensus on when one should have a hearing exam. There's like no screening. So you think of like mammograms as a screening tool for breast cancer, and there are certain guidelines for that, right? But the medical community and the hearing community have not reached a consensus that we should be routinely testing or having screening hearing exams. And so it's really up to you if you're concerned about your hearing, or it's usually your family members are saying that your TV's too loud or you didn't hear me, that make you to sort of think about your hearing as being a problem. So there's no recommended age; it's more based on your experience and symptoms. And you don't have to have an existing condition. No, if you have a concern is enough. And so go get a hearing test. And if the hearing is normal, great. If it's not, then the audiologist and or your primary care doctor should make some recommendations about next steps.
Very good. Okay, you have another question. Hi, Brandon. Are there any new hearing loss innovations? Seems odd that we are in the 21st century, but we only have hearing aids for hearing loss.
Yes, the ear is a very complex thing. We actually joke that as ear, nose, and throat specialists that this thing is actually not the ear. It's the stuff that's really inside that no one sees but us. And so it's a very complex organ, although it's very small. And so to answer your question, Brandon, unfortunately, no, we don't have anything beyond hearing aids necessarily to address sort of a milder form of hearing loss. I sort of talked about cochlear implants and other devices when the hearing loss is pretty severe. But yes, so there's really no way of sort of preventing these things from happening. It's just sort of a part of a natural process at times for some people that age.
Gotcha. Okay, so there are people who have hearing loss, and then there are those who just can't hear and they use sign language. Is there a point that you get to when your hearing is so bad that you suggest that someone begins to learn ASL?
Yeah. Yes. So if there are people that have nerve type hearing loss that's progressive. So it gets worse over time where you essentially become legally deaf.
Mm-hmm.
And if you, opt not to proceed with the surgical intervention, so having the cochlear implant, then I would suggest that you, or concurrently, as you're getting worked up for one, learn, sign language or a lot of people that have hearing loss rely on lip reading. And so that became much more challenging when the pandemic started because people weren't wearing masks. And so we actually saw a lot of people who would otherwise not have detected their hearing loss um, get it detected because now people's faces are covering like, oh God, I can't make out what they're saying because they've relied on lips for so long.
Mhm.
And so, yes, if it's to the point where you can't hear, you're not getting benefits with hearing aids, then I would say it's probably time to think about surgical options like a cochlear implant and or relying on other means of sort of detecting
Communicating. Yeah.
language.
Yeah. So I'm on the other end of the spectrum where I hear very well. And I'm wondering sometimes if that's a problem that I talk low because I hear very well and I think everyone can hear me. So let's talk about the person who can on the other end hear well.
Yeah, well, kudos to you. Uh, that can, I mean, that's good in some ways that you have, we call super threshold hearing. So you're actually hearing above what we consider to be normal. Um, in in some ways, that's helpful for you, but again, as you said, the better you hear, sometimes the lower you can speak, and then you have people that are can't hear and they're like, why are you so loud?
Right.
Because they're compensating in the opposite way. And so, it's important. I don't think there's anything medically necessary for you to do that, for your excellent hearing. But it's important for you, especially as you have a passion for caring for um, older patients or aging patients, that you acknowledge at least that you're soft spoken, and sometimes you may have to sort of project so they can understand you and you can accomplish your mutual goals.
Absolutely. Okay. If you are watching and you have a question that you want to get answered before we wrap up, please put it in the comments. Um, Dr. Pleasant, I appreciate you coming and sharing all of your knowledge about aging and hearing loss. You see, we had a lot of questions tonight, and I really appreciate it because there are so many people who I see who either have the TV up loud, they don't hear well with my mask on. There's one patient who I had really interesting story from the aspect of they didn't hear when I spoke louder. They didn't hear when I spoke softer. It was kind of like I had to talk in my normal voice, even though he had a hearing aid. And then it was still, let me read your lips.
Mm.
So that was a whole new experience because I'm used to people saying, okay, talk louder, I'll hear you. But when the person doesn't hear when you speak louder, it's like noise to them. It's not clear speech. Can you talk about that a little bit?
Yes, so that's a person that probably should be evaluated again and have his hearing checked because he may be at a point where just because hearing aids actually just amplify, meaning they just kind of turn up the volume of things. But if
Mm-hmm.
you don't have clarity and you can't make out the sounds, it's actually annoying, and so people just end up tossing the hearing aids because they just hear a bunch of noise. And so that person actually will likely, again, I don't know this for sure, but likely benefit from a cochlear implant evaluation. And so that type of testing is very different. I mean, it's still done by an audiologist, but there are a battery of tests that they do to see if you can be a candidate for a cochlear implant. But yes, your hearing loss can get so bad that just by merely turning up the sound of the volume is not going to help you because that's what hearing aids
Right.
do. And so at some point when you get no benefit from hearing aids, that's when you begin to think about alternative options such as a cochlear implant.
Gotcha. Okay. I don't see any other comments here. So I want to give you an opportunity to either recap or give us a final thought, something that you didn't say that you think is really important for us as caring for our aging parents or us that are older and we're trying to figure out, am I really not hearing well? Who should I see? All of those things. I appreciate it.
Yeah, no worries. Thanks for having me again. It's
No
always
problem.
a joy to be here and share a little bit of knowledge that I have. So, you know, age-related hearing loss, it's a common thing. Yeah. 50% of the patients 80 years or older have some form of hearing loss. So oftentimes identified by a loved one or a friend. So I think if you have someone that's raising concerns about your hearing, I encourage you to be amenable to at least getting a hearing test.
Mm-hmm.
And, you know, at least to be able to identify if you have a hearing loss, what type of hearing loss you may have, and consider hearing aids. They're a lot fancier these days, where especially patients who have phones, they're like Bluetooth.
Yeah.
They're Bluetooth. You can connect your cell phones to them. You connect
Mm-hmm.
whatever else, your music to them and leave them in and listen. And so, it is a condition that affects us as we age. It's like an aging bone sometimes, but again, it's not everyone. And so I would encourage you to talk to your primary care doctor or visit your local Costco or Sam's Club where they're audiologists to consider testing.
Yep. Okay. I think that's important. The first step anywhere is prevention so that you don't have the condition continue and so
Correct.
that you know exactly what's going on. You talked a little bit too about how hearing loss can affect you cognitively. Is there anything else you want to say about that? I know I had a patient who mentioned how they're trying to determine if the person really isn't hearing or is a cognitive issue. Is there a way to differentiate the two?
Yeah, oftentimes hearing loss, patients who experience hearing loss, their loved ones or people that are close to them mistake their hearing loss for cognitive decline. It's not
Right.
always a cognitive decline, it's simply they just can't hear you. However, we long term, there are cognitive studies that you can do to check one's cognition, particularly for people who are checking for like Alzheimer's and dementia.
Mm-hmm.
Um, it has been shown that there's a greater degree of those cognitive issues in patients who have hearing loss that's unaddressed. And so I think it's really important, again, to identify the hearing loss and try to mitigate um, it in a way of a hearing aid or amplification and or prevent sort of progression of it.
Gotcha. There's a question that I missed. I'm sorry, Brandon. Is any hearing loss hereditary?
Yes, there is a lot of hearing loss that's hereditary. I mean, you usually get hearing loss picked up, a hereditary hearing loss, when you're younger. So we do a lot of screening. We really push for those of you who have grandkids or great grandkids that's coming into the world. It's important for them to get hearing tests at birth, and so there we do newborn hearing screens,
Mhm.
and so that can help identify whether or not a patient has hearing. But yeah, so to answer your question, Brandon, yes, there is hereditary hearing loss, but that is usually younger patients who have hearing loss. It's not necessarily an age-related thing. So because your grandmother has hearing loss doesn't necessarily mean that you're going to have it. And so I always ask my patients, is there a family history of early onset hearing loss? So when it's early and the patient is younger, I get more concerned that there's something hereditary as opposed to something just happening as a aging process.
Got it. A follow-up question from Dr. Marsh. Is there hearing loss in one ethnic group greater than another?
I don't know that necessarily. I don't know that offhand. I had not necessarily found that to be the case. Now, I will say in patients who are from underserved communities or lower socioeconomic status who have limited access to healthcare, I think they are at risk for having undetected hearing loss, partly because they have challenges getting healthcare. And as you know, those tend to be in communities in minoritized populations. But I would not say that anything that I'm aware of that say because you are of one ethnic group, you have a certain degree of hearing loss. Now, there are groups of people that have uh, communities where family members are mixing. And so we do, and having children, we do know that, like Amish community, that they have a greater degree of hearing loss. And that's because there's mixing of family members in terms of having children. So those kids, we actually have an Amish clinic, hearing loss clinic here at the University of Michigan, because we do know that population has a risk of hearing loss.
Gotcha. Well, thank you for sharing that and for all of your knowledge tonight. I've learned a lot. I'm going to try to stop using Q-tips.
Please. It's been what? How long? Was it been 2 years ago, or was it a year? I can't remember when the last time we had that conversation. But
it was last year.
Got it. Okay.
I'm gonna work on it, and I'm gonna try the baby oil in my ear and see if an earwax comes out.
Yes.
Or I can use mineral oil. Isn't that what you said?
Mineral oil or baby oil. Correct.
Gotcha.
Oh, someone's saying go blue. I love it. Go blue. The game's coming on soon. I hope you're watching it.
Okay, well, let me get you out of here.
No. It's 8:00. No.
Okay.
Yeah.
Awesome. Thank you, everybody, for your comments. We appreciate you watching. As always, pull up with Limbs and Things is to confirm something you know, challenge something you don't know, and give you the opportunity to share that information with someone else. Dr. Pleasant, thank you for sharing this information. And we hope that you all have a wonderful holiday season. And be sure to listen to your family members, see if they can hear while you guys are together. All right. Thank you so much, Dr. Pleasant.
You're welcome. Have a good one.
You too. Oh, and did I say thank you as a Banneker alum? Did I say that?
Oh, yeah, that's right. You're welcome. Absolutely.
All right. Thank you, guys. Have a good evening.
All right. Take care.
Bye-bye.